Of patient. Now, I am joined by Dr. Shreka, who is from Norvik Hospital, to give us a broader understanding of plastic and cosmetic surgery. And he's a surgeon himself, and so we just need to understand plastic surgery as a whole and cosmetic surgery. So, first of all, good morning.
Good morning, Priscilla.
You're most welcome to the show.
Thank you.
First question is, what's the difference between cosmetic surgery and plastic surgery?
Yeah, plastic surgery is the broader term of my field. Plastic surgery has many subdivisions, and cosmetic surgery is just one part of plastic surgery. You know, as plastic surgeons, we are trained to do lots of different things. We do, hand injuries, we do congenital anomalies, we do burns, we treat a lot of burns, we treat a lot of trauma. And cosmetic surgery is just one part of plastic surgery. So broadly speaking, we are plastic surgeons, but me personally, we specialize more into cosmetic surgeries.
Okay, all right. So walk us through the different surgery procedures that you actually offer.
As I said, we at Norvik Hospital focus, me personally, we focus on cosmetic surgeries. So when we talk cosmetic surgeries, there's other surgeries which target to beautify a person or target to change their body proportions in a way which is more aesthetically pleasing. So some of the procedures we focus on are like liposuction, breast lifts, breast reductions, breast augmentations, tummy tucks, rhinoplasties, nose jobs, facelifts, lots of things which can help change the individual's outlook.
Mm-hmm. Okay, tell us about the breast reduction surgery.
Yeah, breast reduction is one of the commonest procedures done worldwide by most plastic surgeons. It is usually done in ladies who have big breasts. Big breasts come with their own problems. Most women with big breasts have issues like they have chronic backache, they have neck pains, they have postural issues, they tend to hunch, and sometimes they even have fungal infections under their breasts. So they have lots of different issues which can be corrected by this breast reduction. In breast reduction, basically we are trying to not only reduce the size of the breast, but also make it more aesthetic. When we say aesthetic, we are trying to make it more proportionate. We are trying to lift the breast, and we are trying to do it in a way which is suitable to the lady overall.
Okay, so if I'm one with such a case, when and why should I actually opt for surgical services?
Yeah, see, breast reduction can be done at any point in a female's life, except of course when you're pregnant or lactating. So once you finish lactating, it's okay to do at any point in your life if you're especially suffering from any of the issues like backache, neck pain, or you just want to look aesthetically more pleasing. You can do it at any point.
Okay, all right. So we have looked at reduction. How about if I want to increase my breasts?
Yeah, that is the in thing, isn't it? Everyone wants to know how to increase the breast size in people. Yeah, there are different ways of doing it. Again, there are broadly speaking two main methods of doing a breast increasing surgery, which is called as breast augmentation surgery. Those two methods are, one is by using silicone implants, which are objects which are made of silicone, which we place it under the breast to increase the size. The other option is to use your own body fat. That is called as fat grafting. In that procedure, we take out fat from your tummy or thighs or somewhere else, and then we process it and purify it, and then we put it in the breast. So that increases the breast size. So broadly speaking, yeah, these two are the common methods of doing a breast augmentation.
Okay, all right. Could you give us a detailed picture of the procedure that you go through or with the patient to be able to do the reduction on breast?
Yeah. Normally when a lady comes for breast reduction, usually they have finished their, having their children. Normally
you recommend it after you have
in most cases
this is the last child I'm having.
Yes, in most cases. The reason is if we do breast reduction and if they again become pregnant, there is a chance the breast size can again increase to an extent. But if someone is suffering really from the issues related to breast reduction, we can even do it before pregnancies. That is also accepted. So when someone comes for breast reduction, first thing is we examine, we rule out there is nothing untoward with the breast tissue per se. And we also normally do ultrasound scans to check whether everything inside is fine. And then we discuss with the lady how small she wants to go. We can do it any size, whatever she wants. We also suggest, depending on her weight, height, and other factors, even her shoulder width matters when we are deciding about a size. So once we discuss all this, we come to a consensus, like such size would be suitable to her, like say a C cup, D cup, or whatever. And then after that we have to do some blood work, and once we do all that, then we can go ahead with the procedure. The procedure itself takes about 1.5 to 2 hours, and normally they can go home on the same day or sometimes the next day, and they can get back to their normal work within about 5 days, and they can even work out after 3 weeks. So that's the usual recovery phase of a...
Wow.
Yeah.
5 days, and then in 3 weeks you can go back and hit the gym.
Yes.
Okay, all right. So the recommendation is that a lady who wants this kind of procedure must consider having given birth to their last child.
That is preferable. Yeah.
That's the preference that
Yes.
you recommend. However, those are not the cases you're receiving.
Yes.
You're receiving active moms who are still
Yes.
giving birth. So when they actually come for this procedure and then they give birth, how does that affect the mother-child bonding, especially through breast and breast milk?
Yeah, there are two issues there. One is when they get pregnant after a breast reduction. Scientifically speaking, there is less than 1% chance of her not being able to breastfeed. It is known to happen, but it is quite rare. The other issue is they may notice a slight increase in size of the breast when they get pregnant because of the hormonal issues. But though there is an increase in size, it is generally not to the extent which it was before, before we did the reduction. Okay. So these two are the things they need to keep in mind before we go ahead with breast reductions.
All right. Take us through the risks that are actually present through the procedure and even post-procedure.
Yeah. See, risks are always evaluated in our field. Before we accept a certain risk, we need to know what it is. So how we come to that point is by doing a proper pre-surgical evaluation. We do a set of tests to check the lady's health, because she obviously needs to be fit for us to be doing the procedure. Because first thing is, this procedure is done under general anesthesia, right? So before that we need to do a certain blood work, and also our anesthetist does something called as pre-anesthetic check, wherein they check and assess whether the client is able to handle these kind of procedures. Once this is all sorted, only then we actually proceed and do the surgery. So when we are going for a surgery, we know that it is quite safe. Otherwise, obviously, it doesn't make sense to risk it. So once we go ahead, the overall breast reduction is quite a safe procedure. Generally, the complications with breast reductions are quite rare. Some rare things that can happen are maybe some people may have a bit of delayed healing that can happen, especially if you're a smoker. But apart from that, other complications, though there are known to happen, they are quite rare, especially if our pre-anesthetic check and our pre-surgical evaluation has been thorough. Yeah.
Okay, Dr. Shrika, I have come for my procedure and I'm not happy with the end result. Is it a reversible procedure? It
is reversible in the sense that obviously we cannot increase the size. We can if you want to, but generally breast reduction is very predictable. So before the surgery, as I said, when we plan, we want to do a certain size, it is usually achievable. It's very rare that a client comes back saying that I'm not very happy. That's, frankly speaking, never really happened. So it theoretically can happen, but yeah, it's quite rare.
Yeah. Okay, all right. In your parting shots, in your closing remarks.
See, as I said, cosmetic surgery is a subcomponent of plastic surgery. We at Norwich Hospital in Bamboo Road, we focus on cosmetic surgeries like liposuction, breast reduction, breast lift, breast augmentation, and tummy tuck. So yeah, if you want to know more about it, just drop by.
Okay, what's the cost implication of having these procedures?
Cost depends. Normally it depends on the client, because as I said, it depends on how long their surgery is likely to take, whether they have any pre-existing health issues, in which case they may need more checkups, and different factors like this, whether they're going to stay for 1 night, 2 nights, depending on that. But normally anywhere between $4,000 to $5,000 is the norm.
$5,000
approximately.
Okay.
Yes.
All right. Well, thank you so much, Dr. Shrika. And for those of you that need surgical reconstruction or correction, you can always stop by at Dr. Shrika's at Norwich Hospital, and they can be able to sort you out. For the women out there who feel like you want your breasts to give you a better look, better posture, or for those of you that have suffered for long or know people who are suffering with heavy overweight breasts compared to their height and their body size and their weight, you can always consider these procedures to have a reduction that is enabling of your height and your weight, and other factors of course considered. They definitely take you through various procedures. They give you as much counseling as possible before you get to pen to paper on consent of having such procedures. So I trust that that has been very informative for you. We're going to be taking a short break. We return with Stephen Mbi.